Focus on Your Health is sponsored by MU Healthcare.
It's been just a little more than 2 weeks since MU Healthcare announced Anthem has removed the health system from its commercial plans. But there still seems to be a lot of confusion and misinformation out there. So I'm joined now by Tanya Johnson, MU Healthcare's Chief Operating Officer, to give us the latest. Thanks so much for being with me, Tanya.
Thank you for having me.
Elephant in the room is 39%. Is MU Healthcare asking for that drastic of an increase?
Absolutely not. That was our initial proposal in July of 2024. So we were asking for 39% over 3 years, which is actually only a 13% increase annually. Now, it sounds like a big number, but in reality, when you consider the rising costs that MU Healthcare has experienced over the past several years, actually isn't even keeping up with those costs or inflation, which is around 1% to 2% each year. Our original proposal was simply getting us in parity with peer academic medical centers by 2028, rates that they're already being paid right now. We're about 30% behind them when you consider the rates we're currently being paid.
Okay, and so our negotiations still very far apart?
Yes, unfortunately, Anthem has proposed only a 1% to 2% increase. And again, when you consider the rising costs, it doesn't even cover that for the cost of living. Over the past years, we've seen about a 7.3% increase in drugs, supplies, labor costs, and our reimbursement rates have only increased by about 3%.
Mm-hmm. And what do you say if somebody says MU Healthcare is just being greedy?
Oh, that comes up a lot. But when you really think about, we're a nonprofit organization, right? Which means we reinvest any profits that we get back into our patients, our technology, our buildings. When you think about the $232 million we invested in the Children's Hospital and Birthing Center, which we're sitting in right now, that's what we do. We don't give payouts or bonuses like a for-profit does. We invest in new programs like our bone marrow transplant BMT program or our maternal fetal surgical program. Cutting-edge technology and treatments that people need in this mid-Missouri region and deserve.
So would you say the relationship between MU Healthcare and Anthem, is it officially done, or is there hope?
No, we remain very open to negotiations. Unfortunately, Anthem continues to come to the table with very low offers, in some instances rates that are worse than our current rates with Anthem. We need to be here for the future of mid-Missouri, and we cannot put that at risk, and so we have to hold firm.
And I know you're worried about the patients, obviously. What do you say to them? Where do they need to go for care?
Some of our local health systems have stepped up to provide some care, but we offer 30 pediatric specialties. We're the only children's hospital in the region. We offer complex maternal fetal medicine that you cannot get at other health systems. We accept thousands of referrals from other hospitals every single year because they need complex care that only we can provide. You know, what I say to patients right now and families is call Anthem. Tell them you need our services, you need MU Healthcare services and providers in network, and ask them to reinstate us into their commercial network.
Wonderful. Thank you so much, Shani, for being with us. We really appreciate it. That helps clear the air on the MU Healthcare's negotiations with Anthem. And to learn more, you can visit muhealth.org/Anthem Talks. For Focus on Your Health, I'm Meg Judy.
Focus on Your Health has been sponsored by MU Healthcare.